Hi, my name is Charlotte, and I'm a medical student at the University of Vermont. Today I'm going to be talking about the federal government's guidelines for reopening the country. Much of the discussion around COVID-19 has shifted from how to flatten the curve to how to reopen the economy and get things back to normal. On April 16, 2020, the White House released the Opening Up America Again plan. The plan has 3 phases to gradually ease Americans back into the workforce and get things back as close to normal as they can be. Before these phases begin, 3 main criteria must be met. There must be a downward trend of flu-like and COVID-19-like symptoms for 14 days. There must be a downward trend of documented cases or positive tests as a % of total tests within 14 days. And hospitals must be able to treat all patients without crisis care and have robust testing programs in place for at-risk healthcare workers, including emerging antibody testing. Once those are met, Phase 1 can begin. During Phase 1, all vulnerable individuals must continue to shelter. When in public, individuals should maximize distance and avoid places with greater than 10 people. Additionally, individuals should minimize all non-essential travel for both leisure and business. When possible, people should continue to work from home. For those unable to do so, employees should return to work in phases. Employers should close common areas and make special accommodations for vulnerable staff. Schools and bars should remain closed, and organized events will not take place. Gyms and large venues may reopen if they follow strict protocols. Elective surgeries can resume as outpatient procedures. Once there is no evidence of a rebound and the gating criteria continues to be satisfied, Phase 2 can begin. Vulnerable individuals should continue to shelter in place. Low-risk individuals should continue to maximize physical distance from others while in public and avoid gatherings of greater than 50 people. Non-essential travel can finally resume. Telework should continue where possible. In-person businesses should keep common areas closed or enforce strict social distancing protocols. Employers should also continue to accommodate staff who are vulnerable. Schools and organized youth activities, large venues, and gyms can open, as long as everyone continues to practice social distancing. Bars can operate with diminished standing room occupancy. Visits to senior care centers and hospitals are still not allowed, while both inpatient and outpatient surgeries can resume. Finally, Phase 3 can begin once there is no evidence of a rebound and the gating criteria are satisfied for a third time. Phase 3 will look as close to normal as possible. Vulnerable individuals will be able to resume public interactions while practicing social distancing, and low-risk individuals should minimize time spent in crowded areas. Employers can resume unrestricted staffing. Visits may resume at hospitals and senior care centers, and large venues can operate under social distancing protocols. Gyms and bars can also open as long as they adhere to sanitation and occupancy protocols. At this point in time, it is very hard to know when each of these phases will begin and how long each will last. This decision to lift stay-at-home orders has been given to the governors of individual states. Several states, such as Georgia and Texas, have reopened several non-essential businesses in the past few weeks despite not meeting the 3 gating criteria. Despite talks of reopening the economy, the CDC and WHO continue to urge citizens and governments to avoid premature actions that could potentially contribute to a second wave. Until more is understood about the virus and its long-term effects on the body, the public should continue to follow social distancing guidelines. Thanks for watching. To learn more, visit publichealthcoalition.org.